Come in.
Hi, how are you?
Good, how are you?
Good, thank you. I'm Amber. I'm going to be your nurse today. Can you please tell me your full name and date of birth?
Shannon Leona Omert, 52477.
Perfect. I'm just going to check your wristband here. Okay, it matches what you told me. How are you feeling today?
Pretty good.
Good. And can you tell me if you understand why you're here?
I had to get my assessment.
Okay, perfect. And can you tell me the date today?
July 2nd, 2019.
Perfect. Patient is alert and oriented ×3. So Shannon, today I am going to be doing a head-to-toe assessment on you if that's okay, which requires me to do some palpating, some touching around, and I will walk you through every step of the way. Is it okay if I do your head-to-toe assessment?
Yes.
Perfect. So first off, I would take your vital signs. I would get your blood pressure, your pulse, respirations, temperature, your oxygen saturations, and I would assess your pain. So can you please tell me if you're in any pain today?
No.
Okay. Please let me know during the assessment if you experience any pain or discomfort, okay?
Okay.
As I'm doing my patient's assessment, I'm going to assess skin thoroughly. At this point, I would ask her to get down into a gown, and I would assess skin as I go through the assessment. So I'm going to start off by inspecting and palpating your scalp. I'm looking to make sure that hair is distributed evenly and that I don't feel any lumps or lesions. Everything feels good. I'm going to palpate your frontal sinuses, moving down to your maxillary. Then I'm going to palpate your lymph nodes, your preauricular, posterior auricular, occipital. I'm going to palpate your submental, your submandibular, jugulo-digastric, your superior chain, your deep chain, and your posterior chain, your supraclavicular down here, and then I'm going to pinch your skin right here, checking your skin turgor. I want to make sure that there's no tenting. If there is tenting, that could mean that you're dehydrated. Next, I'm going to palpate your nose. Let me know if you have any pain or tenderness. And then I'm going to palpate your ears and inspect them, make sure that they're equal and I don't feel any lumps or lesions. Any pain as I do that? Perfect. Next, I'm going to go through your cranial nerves. So for cranial nerve 1, I'm going to have you close off one of your nostrils and take a deep breath in and out of the opposite one. Perfect, and do the other side. Thank you. For cranial nerve 2, I'd have you walk over to the Snellen chart. I'd have you stand 20 feet away, and I'd have you read down to the farthest line that you possibly could so we could assess your vision. For cranial nerves 3, 4, and 6, I'm going to do some eye tests. So first off, I'm going to assess extraocular movements with your eyes. So what I want you to do, please, is to stare at my pen light, and then when I move it, I want you to follow it with your eyes only and not to move your head, okay?
Okay.
Go ahead and look at the pen light. And I'm coming back to the middle each time. Perfect. Next, I'm going to check your pupils. So first off, I'm going to look at the size of them, make sure that they're equal and round, and now I'm going to check to make sure that they're reactive to light. So I am going to shine a light in your eyes if that's okay.
Okay.
So go ahead and just kind of look straight ahead. I'm going to check this eye first. Now I'm assessing this eye, this pupil. Now I'm going to assess this pupil. Perfect. Your pupils are both reactive to light. Now I'm going to check for accommodation. So I'm going to have you look at this pen light, please. And then go ahead and look at that back wall. Look back at the pen light and back at the back wall. Perfect. Your eyes are accommodating. Thank you. Cranial nerve 5, I'm going to check for sensation. So I'm going to swipe this across your face. I need you to close your eyes and tell me if you feel a hard or a soft sensation and where you feel it, okay?
Okay. Forehead soft, hard, soft cheek, hard, chin soft, hard.
Perfect. Thank you. For cranial nerve 7, I'm going to have you smile for me and frown and then puff your cheeks. Perfect. Cranial nerve 8, I will do in a second. Cranial nerve 9 and 10. What I need to do is I need to look inside your mouth. So if you could please open your mouth and say ah, and stick your tongue out. I'm gonna check the uvula. Go ahead and say ah. Good. Making sure that the uvula lifts with phonation. You're gonna check gag reflex at this time. Cranial nerve 11. I'm gonna have you shrug your shoulders for me and go ahead and turn your head to the side and then to the other side. Perfect. And then cranial nerve 12. Can I have you stick your tongue straight out? And I'm just checking to make sure there's no deviations when you do that. I'm gonna go around to the back side really quick and do a couple tests if that's okay.
Okay.
Okay, so now I'm gonna do the whisper test. So Shannon, if you could please plug off your left ear. Now I'm gonna whisper 3 words to you. Please repeat them back to me, okay?
Okay. Ball house dog.
Oh, sorry. Can you please plug the other ear?
Red shoe house.
Perfect. Cranial nerve 8 and all of your other cranial nerves are intact today. Now I'm going to work on your respiratory system. So first I'm going to inspect my patient, make sure she's not in respiratory distress. There's no tripod position going on. There's no nasal flaring. My patient looks like she's not in respiratory distress, so I'm going to move on to palpation. What I'm going to do is I'm going to do tactile fremitus. So, Shannon, when I move my hands down your back, each time I'm going to ask you to say the words 99, please.
99, 99, 99, 99.
Perfect. And while I'm down here, can you please empty your lungs for me? Take a deep breath out. And then go ahead and take a deep breath in. And back out again. Perfect. That was checking chest expansion, and it is equal bilaterally. Now I'm going to do some percussing, Shannon. So that's just me doing some gentle tapping on your back. Okay.
Okay.
And what I'm listening for is resonance. I want to make sure I don't hear any dullness throughout the lung fields. Perfect. And the last thing I'm going to do is I'm going to auscultate your lung sound. So Shannon, each time I move my stethoscope, if you could please take a deep breath in and out for me. And I'm going to use the diaphragm of my stethoscope. Not moving on until my patient has taken a deep breath in and out. And I'm assessing upper lobes, mid lobes, and lower lobes. Perfect. Upper, middle, and lower lobes are clear bilaterally. So now I'm going to come back around to the front, and I'm going to auscultate anteriorly. So same thing, just take some deep breaths in and out as I move my stethoscope. Thank you, Shannon. Next, I'm going to assess your carotid arteries. So I'm going to palpate them one at a time. And they should be 2+ bilaterally. Now I'm going to check for carotid bruits. So the way that I do this is I'm going to have you take a deep breath out and hold it, okay? I'm going to listen with the bell of my stethoscope. Deep breath out and hold it. Angle of the jaw, mid-cervical, base of the neck. Okay, Shannon, go ahead and take some deep breaths. Catch your breath again. And then I'm going to have you empty your lungs and hold it. Angle of the jaw, mid-cervical, base of the neck. Perfect. And I should not hear any carotid bruits, which I don't, so that's normal. Now I'm going to have you lie down for me, please. I'm going to do your cardiac assessment. So I'm going to be inspecting for any lifts or heaves, and I don't see any, which is normal. I'm going to palpate for any thrills. Next, I'm going to auscultate your heart sounds using the diaphragm of the stethoscope. I'm going to work my way down to the second intercostal space on the right side, listening to the aortic. Moving over to the pulmonic. Moving down one intercostal space to the Erb's point. Moving down to tricuspid. And finally, fifth intercostal space, mid-clavicular, I'm listening to the mitral. I'm auscultating and hearing S1, S2 sounds, so I am done with my cardiac assessment. I'm going to move on to my abdominal assessment. I'm going to be inspecting your abdomen. I'm looking to make sure that I don't see any masses or any pulsations in the abdomen. I do not see any, so now I'm going to auscultate for bowel sounds. Starting in the right lower quadrant with my diaphragm. Working my way in a clockwise motion. Listening for at least 5 bowel sounds. Shannon, can you point to me where your belly button is at, please? Perfect. I'm going to listen to vascular sounds or bruits in your abdomen. So I'm going to start up here with the bell of my stethoscope at the aortic. Then I'm going to move down to renal, iliac, and then femoral. And I did not hear any bruits in your abdomen, which is normal. Now I'm going to percuss your abdomen. Listening for making sure there's no dullness. Then I'm going to palpate light. Let me know if you have any pain or tenderness as I do this, okay? And then I'm going to do deep palpation. Okay, Shannon, so can I have you lay your arms down? I'm going to check the radial pulses bilaterally, making sure both of them are 2+ and equal bilateral. Can I have you squeeze both my hands as hard as you can? Squeeze, squeeze, squeeze. Good. Now I'm going to check your cap refill, making sure that it's less than 3 seconds. And I'm going to check all of your nails for any clubbing. I can check skin and temperature as I'm working my way up your arm, checking for any edema. And now I'm going to check your lower extremities, palpating for any edema, also palpating the skin temperature. While I'm down here, I'm going to palpate the pedal pulses bilaterally, making sure that they are 2+. I'm going to check your cap refill down here. Now Shannon, I'm going to check your lower extremity strength. Can I have you push up on my hands towards your nose, both of your feet? And then go ahead and push on the gas pedal. Beautiful. All right, Shannon, I'm going to help you up to the sitting position. Now can I have you stand up, please? We're going to do some range of motion exercises. So if I could have you flex your head forward and then go ahead and extend it back. Good. I'm going to have you abduct your arms and then adduct them. And then your right leg, can I have you abduct and adduct? And then with your left leg, abduct, adduct. Good. Can I have you bend forward, please? And I'm going to check your spine for scoliosis. I want to make sure that it's very straight. Okay, it looks good, Shannon. And then the last thing, can I please have you walk five steps ahead of you and then come back, please? While she's doing this, I'm assessing her gait. And go ahead and come back. Perfect. Patient looks like she has a stable, steady gait. All right, go ahead and take a seat. Do you have any questions for me?
I don't.
Okay, thank you for letting me do your assessment. I will go and document my findings.
Great, thank you.
Thanks.